I'm here with Dr. Lander today at the Parisi Speed School in Morristown, and we have a fantastic situation as a speed school because we are here at Atlantic Health as part of a relationship that we're all doing, and so we have access to literally some of the best doctors in the state, maybe even in the country, and today we have a really incredible topic, which is cardiac arrest in athletes, and this is Dr. Lander's expertise. So I'm just going to ask Dr. Lander to tell us a little bit about his background, how you ended up doing this. It's really kind of nobody thinks about this. You don't think about, your child, going into cardiac arrest on a ball field in some way.
No.
So tell us a little about your background, how you got here, and then we'll start right into what we want to talk about.
Sure. So I'm an adult cardiologist, so I see patients from high school age all the way up and on throughout. And so when you relate that to the athlete, that's everything from the high school athlete to the college athlete, professional athlete, master's athlete, to the weekend warriors, you name it, we get to see them all. And within cardiology, my kind of sub-area of interest in there is sports cardiology, which to me what's fascinating about sports cardiology is that, particularly in the US, it's this kind of newer field within cardiology. So we have a lot of great new information, new studies that are coming out, and I trained in, I'm a local guy, I grew up locally, I trained in New York City, had some experience there with athletes and also with the FDNY, which is a similar crossover type of patient. Now I'm here at Atlantic, helping to run the sports cardiology program where we work closely cardiology-wise, but also with the sports medicine doctors.
Oh, that's awesome. So tell us, Doctor, give us a definition, what is sudden cardiac arrest?
Sure. So like you mentioned earlier, it's scary. When it happens, it's scary. So sudden cardiac arrest is when the heart abruptly stops pumping, stops functioning the way it's supposed to. And when that happens, the heart's not perfusing the rest of the organs, so there's not enough blood getting to the brain, getting to the vital organs, getting to everywhere else. And when this happens in the athlete, it's scary. We expect these athletes to be extremely in good shape and in top health.
Right.
But it can happen to anybody. So when it does happen, we usually see the athlete passing out, more or less motionless. Sometimes you can see a little shaking type motion. And if we don't restore that proper heart function quickly, this can lead to scary things, can lead to death.
So when you see this happen, is it generally from a precondition?
Yes and no. So there's three main things that we look, underlying causes that can do this. So one are structural issues with the heart, so the actual structure of the heart itself, with the muscle, for example, with the valves, for example, that can do it. Sometimes there are electrical abnormalities that can do it. And the third big one are more acquired causes. So those are the infections can do it, medications, drug use can do it. Those are the three big areas that we pull from that can lead to these sudden cardiac arrest.
So how worried, and I know we're going to talk about a few more things, how worried should a parent be of an athlete, that's going out there and they're sometimes playing 1, 2, or 3 sports?
No, that's a great question, because I'm a parent, and just like every other parent, we all worry about it. You don't want to think about it, but it's there in the back of our minds. The bad news is that yes, it can happen. The good news is that it's very uncommon that it happens. So for example, if we take the high school athlete, the rate of sudden cardiac arrest in our high school athletes are about 1 in 100,000 to about 1 in 200,000. So not common. It gets a little more common as we get older. For example, in the college athlete, it's about 1 in 100,000 that we see it. So it's scary. It happens, but fortunately, it's uncommon when it does happen.
Okay, wow. I'm glad my kids are all grown now, out of all the athletic fields, but I'm sure it's always a concern. What are the warning signs, if there are any, of sudden cardiac arrest in an athlete?
Sometimes there are no warning signs. A lot of times there are warning signs. So the big things that we like to look out for are some of the common things you might think of. So if the athlete is complaining of chest pain, they're complaining of shortness of breath, dizzy, or even something obvious like passing out while exercising or immediately following exercise are big ones that we look out for. sometimes, like I mentioned, it can happen without warning signs. Sometimes there are obvious warning signs like we talked about. Other times it's more subtle, like for example, the athlete used to run, we'll call it a 6-minute mile. Now all of a sudden it's 6:20, it's 6:30, or in the team sport they're just not keeping up with their teammates or keeping up with that baseline that they used to. Those can all be subtle signs that we look for.
That's really interesting to me. So, as they're going through, like, some of the early signs that you just said could happen, like with any highly active sport like soccer, lacrosse, football. You'll see they're tired, they're sweating. They might get shortness of breath if they're running too much. Is that an easy thing to spot for a coach, or is it more the individual athlete might be able to see it faster because they know their own body?
I think it's a combination of the two. So the athlete has to be aware of it. Sometimes it's a little bit tricky because we all know athletes, they want to play, they don't want to stop no matter what, they want to keep going. But it's important that they know to look out for these signs. And the coaches, the trainers, the team doctors, the parents, they should all, something that they should keep an eye on as well, because it's, your own students, your own athletes, your own children well, and you can tell when there's something that's a little bit off or a change from what they used to have.
Right, being in tune. Yeah, I agree with that. So when it comes to this topic, which is really, again, it's a scary topic, and it's one that's not often thought of by the parent, but do we screen for it? Should we screen for it? Can we screen for it? Who should be screened for it?
So the answer across the board is yes. So we should definitely screen. Every athlete should be screened, whether you're actively having symptoms or not having symptoms. Everyone should have a pre-participation examination. Right now, kind of the standard of care for a pre-participation examination is twofold. It's a history, which we break down to a personal history. So are you, the athlete, having any symptoms that we talked about? So it's a personal history coupled with a family history. Has anyone in the family ever died at a young age, suddenly, unexpectedly? Has there ever been a drowning or car accident in the family that's been unexplained? Or does anyone in the family have known cardiac symptoms? So we have the history component, and then we have the physical examination component. If we find an abnormality in the history or the physical, we may want to go on, do some additional testing, do an EKG, do an echocardiogram, and we have more advanced testings that we can do as well if the need arises. And we're here, we mentioned Morristown, we're lucky, we have a great program, great physicians here who help with not just the screening of the athletes, but with when problems do arise, complex cases, we have the expertise here to be able to handle those cases.
So, okay, so I'm a parent of 3 kids, played lots of sports. Is this something, when we talk about a screening, is the first screen their actual annual physical? Are we looking for that in the annual physical? Is it something that they should say, wait a minute, let me go over, like, certainly local, hey, should we go to Atlantic Health for this specifically?
So it varies by state. So we're in New Jersey. We're here in New Jersey. We're lucky we have a newish law in New Jersey where every school athlete has to have a yearly physical examination, which can be done by any physician. There is an online module that they have to take and pass. So they have some background information about what we want to look for that's athlete specific. So every school-age athlete should be screened once a year. It can be done by their local physician so long as they've taken that module. And then if their local physician finds something that's not sitting right or a more obvious abnormality, they can refer them over to someone who deals with the athlete more commonly on an everyday basis. If you think about training with the athlete, just like they go to the gym, their skeletal muscles change, the heart's a muscle, the heart changes as well. And there's normal cardiac heart adaptations that we see with training that on an EKG, for example, may look like an abnormality in a non-athlete, but for the athlete, it's something that's totally normal, and vice versa.
Wow. So I'm getting more and more questions in my head that because I'm thinking like a parent, and I'm saying, wait a minute, will my general practitioner, my internist that I send my child to for their normal annual physical, is this something they're definitely going to do? Is it a question I need to ask my doctor about? what would you suggest?
So I'm always a fan of being your own child, your own self-advocate, and always ask the question. If you're not sure, just ask the question. As doctors, that's what we're here for. We're here to help you to answer questions. So ask your doctor. It is something they should be doing. And again, like I mentioned, it varies a little bit by state, but here in New Jersey, we're lucky, you have to have a form filled out. It has to be filled out by your practitioner. So that's taken care of. But we here with part of the sports program, the sports health, sports cardiology, we work in tandem with the local neighborhood physicians. So we work hand in hand together.
So could a parent, if they wanted to, say, you know what, I don't know if my doctor does it. I feel a little more comfortable maybe going to somebody that's doing it all the time, like yourself. Could they come to Atlantic Health? Would their insurance cover that kind of a thing, or is it vary depending on the insurance?
It varies, but I see that all the time. Patients come in and say, hey, we want something a little more sports specific, so they'll come into the office, and I haven't had a problem with insurance. But again, we do it all the time, and we work closely with the neighborhood, the local doctors, so there's communication both ways.
That's great. So, yeah, that's terrific. That's really scary stuff, but there's answers out there, and you can be a little bit more prepared. So, how can we be more prepared if someone does go into cardiac arrest?
So like we mentioned, it's uncommon that it happens. When it does, it's scary. It's when it happens. And no matter how good our screening is, we try to pick up everything we can, but there'll be things that won't be seen on screening. So there will be these cases of sudden cardiac arrest on the field. So the most important thing is that whether this be at a school or a club sport or wherever, that there be an emergency action plan. So basically what that is, that's a plan that's set up in place and rehearsed so that when an event happens, everyone's prepared. So for an example, a quick rundown of what an emergency action plan is. A first step would be to be able to recognize when a sudden cardiac arrest or other type of event happens. Once it happens, we have different teams in place. So there'll be one team that it's their job to say, you call 911, and your job is to tell them where we are, how to get here, where's the closest entrance to the field, and make sure there's a direct line of communication, an open line of communication with the emergency responders. Then we'll have another team in place that says it's your job to start providing high-quality CPR. And it's important for coaches, for parents, to know how to do CPR. We'll have a third team that says, okay, it's your job to go get the AED, the automatic external defibrillator. So again, in New Jersey, we're lucky there's a law here that any school-sponsored athletic event, there has to be an AED that's readily accessible on premise. And we need somebody who knows how to use that AED. So we have a team. It's your job to call 911, your job to start high-quality CPR, your job to get the AED. And with everybody working in tandem, just like in sport, everyone has their own job that they do. And when it comes together as a team, we can be successful in having positive outcomes. And again, here at Atlantic, we often work with the community to help set up these emergency action programs. We've been lucky that we've been able to donate defibrillators to local schools. So we're actively involved in the community to raise awareness. The more people who are aware, who know what to look for, who know what to do when it happens, the greater chance we have of keeping that athlete safe and preventing a tragedy.
I mean, this is amazing stuff. I'm just thinking when you said this, and I never thought about this till a month ago. I've been coaching 28 years. I coached football for 15 years on the youth level. And the other day I was at the Morris County Football Coaches Association, and one of the main topics was having a safety team. So taking one coach that all they do on the sideline is put those kinds of things together. That was even more delineated than they did there. But it's one guy's job to watch the players, to watch what's going on very, very specifically, which I thought was fantastic.
Yeah, I love it. It's a great idea.
Yeah, but now that I know, and here I am in the same facility, I didn't realize, like the team 1, team 2, team 3. That's a great thing. I'm going to find out what that is and put that out to our coaches too, and certainly get people more in touch with you, the coaches, the parents. So
we're always here and happy to help.
Yeah, no, that'd be great. Is there anything else that you can think of on this topic that you could give to parents or tell them, or things that they can do to be better prepared? Anything else that you'd want to say as we're sitting here thinking?
Sure. The big thing I would say to sort of sum it up is sudden cardiac arrest is scary. Unfortunately, it's uncommon. And the best thing is to be prepared, to know your student, your child, your athlete, to notice any changes that they may see, and to have a talk with your student or your child or your athlete to say, listen, if you notice something different, don't hold it in. Say something. It's important. You know, we're not trying to keep you from playing. We're just trying to keep you safe while you play.
Right.
So if you notice something different, something a little bit off, let us know. And if there's any question whatsoever, reach out to your doctors, reach out to us. We're here to help and happy to do so.
Dr. Lander, this has been really super informative, more for me than probably anybody else. So I really thank you for coming and talking with us today about that.
My pleasure anytime.
Thank you.
Take care.